Hey guys, welcome to my channel. My name is Janny and I'm a doctor. Currently, I am a first year ObGyn resident. That means that I am an intern in ObGyn. I've actually had a channel before. You can see some of my past videos, but this time it's going to be a little bit different. So currently I have a blog named My Life in Medicine, where I talk about all the things that I am passionate about, including what it's like being a doctor and what my life is like being a doctor. Questions on, what it's like, how to balance everything, how you do this or how you do that. And one of the things that I really want to convey to people out there, potential medical students, potential doctors, potential healthcare professionals, is the fact that you can have a life in medicine and still have hobbies and still have passions and things that you love. So today I want to start with a little bit of a talk on contraceptive methods. I'm going to focus on the long-acting reversible contraceptions, but I'm also going to take you along a couple of other options out there and how you can get your hands on them, as well as giving you resources with good information for how you can educate yourself on contraceptive alternatives. So let's get started. One of the things that I hear a lot is people are a little bit weary about hormones and hormonal methods of birth control. So a really good option that we have right now in terms of reversible contraception is the Paragard. So the Paragard is an IUD. That means it's an intrauterine device. It's designed to help prevent pregnancy. And the good thing about the Paragard is the fact that it has no hormones. It has copper. So if you're allergic to copper, obviously that would be a really major contraindication to this product. But there's other things that are important to keep in mind when considering a non-hormonal option of birth control. So the Paragard, an IUD, basically is a little silicone T. It has a stem across. This one has copper in the body and the little leaves, and then it has a string. So this goes inside the uterus, and the way that it works is it causes inflammatory reactions inside the uterus so that a pregnancy cannot implant. The copper IUD can also be used as emergency contraception because of the same reason. Even if fertilization already occurred, it would not allow implantation. It would be a toxic environment for an embryo. In addition to that, it's very important when you're talking to your doctor about contraceptive options for you to keep in mind things that can make better or worse. So a lot of people go on birth control for medical reasons. They either have very irregular or very heavy periods, very painful periods, and those people would not be very good candidates for the Paragard IUD. The reason being, since it causes so much inflammation, it can be associated with cramping, increased bleeding, and things like that. So a person that has really heavy periods with lots of cramping, I would not be recommending this product on that kind of patient. One of the other good things about this product is the fact that like all other IUDs, you can remove it whenever the patient desires. It allows for the effect of it to be removed really quickly. So within a couple days, you would no longer be having the effects of the IUD. So the Paragard, in difference to the hormonal IUDs, can be left in place for about 10 years. And that is a really good thing for people who are further on in their lives and they kind of want to forget about the birth control method that they're using. And yeah, it's a really good option for those people. But like I said, it's ideal if you don't have long periods or heavy painful periods. So I'm going to show you, I've been fiddling with this for a little bit while talking to you guys. So I'm going to show you how it sort of looks. So this is a little tiny model uterus. I'm pretty sure you can't see it very well. But basically, it's inserted into the uterus. You push it in, you let the little leaves unfold. So you wait about 45 seconds, and then you push it all the way up, and then voila, it's in place. So I'm gonna stand up real quick here and show you a little bit up close so you can see sort of how it looks when it is in place. All right, I think that's almost pretty much everything that I can tell you about the Paragard IUD at this time. There is a lot more information out there about other possible side effects, which this one doesn't really have that many. It's mostly just painful, cramping, and increased bleeding. So that's something that your doctor should tell you if you are considering this option for birth control. You should be expecting that your periods can become heavier, they can become more painful than they were in the past. So moving on to a similar device but works in a different way is the hormonal IUDs. So hormonal IUDs have hormones in them, of course. That sounds a little bit crazy to hear, but it is what it is. You know, the hormones will work a little bit different in your body, and as such have a little bit more side effects sometimes, but they are a really good alternative. So different options for IUDs are the Mirena and Skyla. They are both made by Bayer. They're basically the same thing. The only difference is how long they last. So the Skyla lasts for 3 years and the Mirena lasts for 5 years. They actually last a little bit longer than that, but in the US they're only approved for 3 and 5 years respectively. In addition to that, we have the Liletta. Liletta is pretty much the same thing as Mirena, except that it's a little bit more affordable. So a lot of places carry Liletta instead of Mirena for that same reason. It's basically the same product. It lasts for 5 years, and it has the same mechanism. There's also another IUD called Kyleena. It also works in the same way. It's approved for 5 years, and they have the same hormone, which is the progestin. They don't have estrogen. So similar to the Paragard, the Mirena is a little silicone tea.
When I say Mirena, I actually mean all other IUDs.
As a body and the 2 little leaves, and then in the middle is where the hormones are located and released. The good thing about the Mirena is that the doses that are released continuously is so low that the risk of side effects is a lot lower than with other hormonal birth control methods, like the depot shot, like the next one on which we'll talk in a little bit, and oral contraceptive pills. So it's inserted in the same way. It's got a device, and then they measure how big your uterus is. You can hide it, and then you release it into the uterus, and it lies there. It has a string, so it can be removed and felt in place. The Mirena, I actually have a Mirena, and I am really, really happy with it. So before, I used to have like really, really bad periods. I would be basically miserable for about 3 to 4 days out of the month, basically having to stay home, really bad side effects. And I had used hormones before, but I had never had really good luck with it. I had really horrible side effects, and I was really worried about, you know, going the route of hormones again. So me and my doctor talked, and we took some decisions, and I decided to give the Mirena a try. We tried a couple other things right before I got the Mirena, but as soon as I got it, I have been really happy with it. I've had it for 2 years now, and I am completely happy with it. In the same line of thought, so people react differently to hormones. So what works for me might not work for you. So that's why it's important to go to your personal doctor and talk to them and figure out what method works the best for you. So in terms of side effects for the Liletta, Mirena, Skyla, and all the IUDs that have progestins in them, so you can have irregular bleeding. That means that between your periods, you can have moments where you're spotting or having some bloody discharge or brown discharge, and all of that is completely normal and to be expected. In addition to that, some people complain of weight gain but this hasn't actually been proven in studies. They think it might be just either an individual kind of thing or a lifestyle change that happens when you're exposed to the hormones. In addition to that, over the first few, like 3 to 6 weeks, is the period where you can start feeling a little bit different than yourself. So you can have some breast tenderness, you can have some cramping, you can get a little bit of different ups and downs and things happening in your body that might not happen later on. So usually if you talk to your doctor about getting an IUD, they will recommend that you have it in place for 3 to 6 months, and that way you can let your body get adjusted to the hormones. The good thing about the IUDs with hormones in them is that they don't affect ovulation. So if that's something that you're concerned about, not ovulating and the works, this is something that doesn't affect that. And that's also a pro and a con. So if you ovulate, you still have the chance of getting pregnant. The chance with the IUD is about 1%. It's 99% effective. And usually the people that do get pregnant, they get pregnant in the first couple of weeks after having the IUD. And the reason is because you still need a second method for the first 3 to 4 weeks. Since, especially if you don't know what part of your cycle you're at when you get it, if you get it right at the beginning, then that risk is a little bit lower. But if you get it like right in the middle or at another time in your cycle, that can be a little bit more difficult to pinpoint. Like I said, they last anywhere from 3 to 5 years. Some of them are in the process of being approved for 6 and 7 years, like they are in the European Union, and they are really reliable. The good thing is that you don't have to think about it. You don't have to remember to take a pill every day. You just get it inserted. You're worry-free for 3 to 5 years. So they are really good methods, and the side effect profile is relatively minimal. Moving on, I also have a model for the implant, the one that goes in your arm, and it's called the Nexplanon. So the Nexplanon is pretty similar to the IUD in the sense that it has progesterone. How it works is you go to your doctor's office, you get some local anesthesia placed in, you get the area cleaned up, and you get it inserted. It's a little rod about 2 to 3 inches, about 2 inches. And then it's in your arm and you can feel it so that you are confident that it's still there. And it releases hormones slowly every day so that your body has a constant exposure to the hormone. Similar to the IUD, the most noticeable side effect is the fact that you can have irregular bleeding. So that means that you can have bleeding in between your periods, and this is usually what people complain the most about. You can also have some inflammation and pain in the area for a couple days after you get it inserted, but that should be relieved with ibuprofen, Tylenol, and medications that you should be able to find at home. So that's basically it for the long-acting reversible contraception. In addition to that, there are other methods that are available and are a little bit cheaper. They're much more known and are more popular. So I'm going to start talking about oral contraceptive pills. So oral contraceptive pills are pills with hormones that basically cause your body to be in a state where it inhibits ovulation. And if you don't ovulate, then your chance of getting pregnant is a lot less. So there's 2 types of contraceptive pills. Combination contraceptive pills, which have estrogen and progesterone-only pills. These 2 are very, very different. So oral contraceptive pills, they're basically pills that have estrogen and progesterone in them, and they work by making your body think that it doesn't need to ovulate, and that's how they inhibit pregnancy. Basically, they have the same hormones that your body makes. The only thing is that all combined pills have estradiol, estradiol, and a different type of progesterone. So the progesterone in them changes, and that's why some people work better on some oral contraceptive pills and some people work better on other ones. If you have certain specific problems, you may be more beneficial for you to be on a specific type of progestin versus another one. Good thing about the oral contraceptive pills, they are about 99% effective if you are 100% diligent in taking them at the same time. If you take it with typical usage, that people sometimes miss pills or they forget or take them later and whatnot, then the effectiveness goes down to about 91%. I have some information here so that I'm kind of like making sure I hit all the points that I want. But you basically can start your pills at any point in your cycle. So the important thing is going to be to use a barrier method for the first 2 to 4 weeks, depending on what time of your cycle you're at, to make sure that you are preventing pregnancy while it takes effect in your body. In addition to that, some of the good things about the pill is that they are very common, they've been around for a long time, they're very known, and the side effects are generally pretty tolerable. Some of these side effects include nausea, mood changes, breast tenderness, cramping, and pregnancy-like symptoms. They usually resolve after about a month or 2 of taking your pills. If they do not, or if you have migraines, you have mood changes that are affecting your life, like before you were okay, now you're severely depressed. These are things that are not normal, and you should definitely go to your doctor and talk to them about it to make sure that everything is still working appropriately. So, like I said, there's 2 types of pills. There is combined estrogen and progesterone pills, and then there's progestin only pills. So the combined ones are more popular because they're more effective, and even if you miss a pill, it's still pretty effective at over 90%. On the other hand, the progesterone only pills are not as effective, and the reason is because the progesterone lasts only about 24 hours in the body. And when I'm counseling my patients, I always make sure to let them know that they have to be very, very diligent when, choosing a birth control method. And if they choose progestin only pills, then I let them know that they have to be even more cautious to taking them at the same time for it to be more optimal and work appropriately and decrease your chances of getting pregnant. So progestin only pills are mostly known by people who have given birth and have wanted to breastfeed, and the reason is because the progesterone doesn't affect breastfeeding at all, versus the estrogen is hypothesized that the estrogen and the combined pills can affect breastfeeding and milk supply. So that's the reason why if you've had a baby and you wanted to breastfeed, they would not give you combined pills, they would give you progestin only pills. It can take a while for your body to go back to the way it was before your pregnancy. So ideally, based on the evidence that we have, you should want to wait 12 to 18 months between your pregnancies to allow your body enough time to heal. In that time, if you're breastfeeding, it's really hard to know when your body gets back to its normal cycle and ovulation and all that. So if you're taking progestin only pills and you're missing a lot of them, it's really hard to know if it's working appropriately, and as such, it can increase your chances of getting pregnant. Moving on, there is another really good method out there. Is not long-term, like years, like the ones that we talked about in the beginning, but it's very popular because it's about once a week. And I'm talking about the NuvaRing and the patch. And the reason that these are popular is because they last about a week, so you change them every week. The ring goes inside the vagina, and the patch can go on your arm or your butt. The patch has a little bit more side effects because it has more irritation and allergic reactions, versus the NuvaRing is pretty side effect free, except for the same side effects that you would get from like oral contraceptive pills. So some people really like it. I have a lot of friends who love the NuvaRing. They swear by it. It's their favorite method, and I gave it a try. It didn't work out for me, but like I said, a lot of things didn't work out for me. You just kind of have to work with your doctor and find what works the best for you. Going back a little bit to pills, another reason that they don't give combined estrogen progestin pills after delivery is the fact that there is a risk of developing blood clots. This risk is increased if you're over 35 or if you smoke, or if you've been recently pregnant, because pregnancy messes with all of your hormones, and after pregnancy your body is trying to get back to the way that it was before. As such, your risk of developing a blood clot is higher, and we wouldn't want to make it higher by giving you a pill that can also increase your risk. You know, you see where I'm going with this? So yeah, there's so much to talk about. I'm going to give you guys a lot of resources that you can use to find all of this information for yourself and bring it and talk to your doctor about it. From that, there are other methods that are not as reliable, and these include the diaphragm, the cervical cap, and spermicide. These methods are not as popular as they used to be because they're not as effective. I don't know that much about them, but I know that some people really like them, but you just have to know that your risk of getting pregnant is a little bit higher with these devices and methods versus other methods. A condom, there is a female condom and a male condom. They're both equally effective. They're around 97% with perfect usage. With typical usage, I think it's about 85%. I'll double check on that. So condoms. Male condoms are about 82% effective with typical usage, and the female is about 79%. The NuvaRing is about 91% effective with typical usage, same as the patch and the pills. They're both all around 90%. I still have a couple methods to talk about. Another long-term contraceptive option is the Depo-Provera, or the shot. It goes in your arm. It lasts about 3 months. There's different versions of it. I didn't know this until I started residency in Texas. So in the United States, it's progestin only. It lasts for 3 months, and it's pretty effective. The only downside is it takes a long time for it to wear off, and some people do not do very well with the side effects. The most common side effect is weight gain and irregular bleeding, and a lot of people don't like this, so they do not prefer the shot. It's actually pretty popular postpartum because it gives you 3 months of protection of like worry-free, and in that meantime you can decide if you want to get a next one on, if you want to go back on pills, or if you want to get an IUD. And it's a good bridge method to use in between. And yeah, I learned during residency that in Mexico there is a Depo shot, but it lasts 1 month, and the difference is that it has a little bit of estrogen, so it can affect breastfeeding, and it can increase your risk of blood clots because it has the estrogen component. Another method that I really like, and this is a very unpopular opinion, there is a lot of good things and information out there on natural family planning. Not gonna go deep into that here because that could be a whole nother video, and I'm actually working on a blog post that talks a little bit about it. When I was having all of these issues with my birth control pills, with the NuvaRing and horrible periods and all of this fiasco, I met some people online and they recommended I read this book. It's called Taking Charge of Your Fertility. And this book was incredibly interesting. So it teaches you how to do fertility awareness method and how to do it properly to both try to conceive a baby and try to avoid pregnancy. I actually did it successfully to avoid pregnancy for about 4 years. But let me tell you, this is not for the faint of heart. This is not for the undedicated. It requires a lot of time, a lot of education, a lot of patience, and a lot of energy invested into it. So basically, fertility awareness method centers about different changes that go on in your body that most people are not aware of. So there's temperature changes in your body before and after ovulation. There's changes in your cervical mucus. There's changes in your cervical position. And the most important thing is awareness of your own cycle, and it takes about 6 months to actually be able to predict your cycle and understand your body enough so that you can successfully avoid pregnancy. And you have to chart everything down every day. You have to write down your symptoms, you have to write down your temperature, you have to take it at the same time every day using the same thermometer. And it's a special thermometer that takes your basal temperature. That is the lowest temperature that your body is at. And it's really labor intensive. It takes a lot of dedication, and the most important part is you either have to abstain during your fertile phase, or you have to use condoms and use as many other methods as you can in order for it to be most effective. It's very unpopular because a lot of people confuse it with the rhythm method. It's definitely not the same thing, and then it takes so much time and education that it's really almost impossible for doctors to be able to teach a patient in one session how to do it successfully. So that's one of the reasons that of the things that I want to do in this channel. I want to give you tools to take charge of your life, take charge of your health, educate yourself so you can make the most informed decision for you and your body. That's one of my goals with this whole channel. It's going to be putting out material out there that gives you guys the information that you need to make an informed decision. And that's a really important thing in medicine nowadays. Everything is about consent and informed decision, and it's about giving your patient the information and education so that they can be in control of their own healthcare, and they want to be more proactive to participate in it. It's not me telling them this is what I think is best for you, this is what I recommend, this is everything that's out there, but I want you to choose what's best for you. This is a really important thing that I've been trying to do, and I've always been so shy and thinking about what other people will think and how to convey my messages out there. And I've been using my blog for a little bit, but I feel like I need to do more. I feel like I can be myself more if I talk to you guys like in front of a camera, because it's a little bit of a better dynamic. And I've had some success with the Instagram lives, so I really wanted to take a chance to transform this into a new platform. I am really excited about this new chapter for my channel, and I hope that you enjoy this video. I hope that you subscribe in the button below, and I don't know, come back, join me, and hopefully leave me in the comments what things you would like for me to talk about. I have a ton of ideas, and I need to find the time to sit down and actually get them done. So like I mentioned at the beginning of my video, there are a ton of resources out there that are really helpful to get yourself informed and get your hands on all of that rich information out there. So two of my favorites are reproductivehealthaccess.org and Bedsider. Bedsider actually did a campaign a couple months back on why you love your contraception, why you love your birth control, and I thought it was an amazing campaign. I've actually been digging through their website, and they have some amazing content out there that you guys can get your hands on to choose the best birth control method for you. And you can print all of this out, take it to your doctor's appointment, and have a conversation. Get out there, take charge of your own health. So I'm gonna leave all of the information in the box below so you can click on it and find so much amazing information out there. So thank you so much for watching, and hopefully I will see you in my next video. Bye guys.